This is Jerry Hesch from the Hesch Institute in Aurora, Colorado, and I treat joints through the whole body. And my client has been walking around with a wonky pelvis. Is that a good medical term, wonky pelvis? You've been aware of your pelvic posture being shifted over to the side for about 10 years?
Correct.
Okay. Well, we've balanced his pelvis through the course of treatment yesterday and today, and now his pelvis is symmetrical in every direction, and it has passive mobility that translates through it in every direction. Okay? Now, if you think about it, he's been walking with his pelvis shifted over to one side and twisted in each plane of the body, and that's going to change how he weight bears through his foot and ankle. Developmentally, he has two different hip joints. His right hip joint only internally rotates about 10 or 15 degrees, whereas his left hip rotates internally 30 degrees. The length of his femur is longer on the left, but his right tibia is taller, and so when he's standing or when he's laying on his back, his leg lengths are actually equal. But when you bend his knees, when he's lying on his back and you bend his knees, you see that one knee is taller, and on the other side that knee is more forward. Okay? Well, doing all of those things could change the weight bearing through the foot and ankle, and I think that's what happened. And I think over time, walking that way altered movement in the joint below the ankle. Now, this is the ankle joint right here where the bottom of the tibia connects to the ankle, and so that joint lets your foot move up and down. All right, it's a little bit of rotational movement, a little bit left and right movement, but for the most part, the ankle goes up and down. Okay, the joint below that is more complex. So if I squeeze the fibula and the tibia and even the talus in between and only move the calcaneus, I can move it outward. That's called eversion, and I can move it inward, and that's called inversion. Inversion and eversion, okay? And then I can twist it, so this being the right foot and ankle, if I twist it outward, the front of the calcaneus goes in, and the biomechanical term for that is adduction. I also like the term internal rotation. When you twist the heel towards the left, the back of the heel goes to the left, then the front of the heel goes outward and the foot follows that movement. The foot points outward, and that's called abduction, abduction, or I like to call it external rotation. Okay? Well, I've tested all the joints throughout his foot and ankle, including the fibula, and all of those joints have good motion. Talus has good motion, fibula and tibia have good motion, the cuneiforms, the navicular, the cuboid, all of those have good motion except for the subtalar joint. And so this is a right foot and ankle, just like his. So the fibula's on the outside, fibula's on the outside here. The subtalar joint is a very complex joint. You could look it up, look up some YouTube videos or do an internet search, and you'll see that it has different shapes of joints. It has 2 or 3 facets, which is the joints of that articulation, and it joins the bottom of the talus bone. Okay, very complex structure. And on his left calcaneus, I can evert the heel. Now, if I only wanted to test motion in the joint between the calcaneus and the talus, then I could squeeze the tibia and fibula, and then this would restrict motion to only that lower joint. Okay? But I don't mind testing in an open context, so some of the rotation is happening in the ankle, but most of it is in the subtalar joint. So I can evert him, I can push the heel outward, and I can push the heel inward. Okay? I can twist the heel outward, and I can twist it inward. Okay? So I hope the camera view is not obstructed. All right? On this foot, he has no outward motion, no abduction. but he has no adduction either. And it's kind of rare for it to be stuck in both directions. There were 2 good articles in Journal of Orthopedic Sports Medicine on the subtalar joint. And I think they were free articles. I think you can access those on the internet. Just do a search called on subtalar joint, S-U-B-T-A-L-A-R, and then the journal is J-O-S-P-T. So he's stuck in both directions, and that's pretty rare. And in one of those studies, it showed 3 different types of subtalar joints, different configurations. I don't know what configuration would contribute to a loss of both directions, but he cannot invert that heel, and he cannot evert it either. So I'm going to see if I can improve that motion. And what I do is I distract the joint by grabbing the heel, and I'm pulling it straight downward. So I'm sitting in a stool facing him, so I'm pulling his heel down towards my belly. So I keep this tension for at least 30 seconds, and I have a moderate amount of pull. Okay? So I continue to maintain that traction, that distraction, and then I twist the foot outward, and I'm actually able to gain a little bit of motion. So I'm going to do this oscillation, keeping the tension at end range. So I'm pushing against that motion barrier, trying to gain a little bit more motion. So we'll do 30 of these in this direction. Okay, and then I'm going to twist it into the other direction, into adduction. I'm still pulling it into distraction. And I would bet that he compensated for this stiffness in his hip, and maybe it inhibited some muscle function, probably the abductor, the gluteus medius, but I didn't test it. So sometimes restoring motion here will release that inhibition. So my regret is I didn't test the body to see where the compensation was. But now that we've treated that 30 times, he now has some eversion motion. Okay? And he also has inversion motion. Okay? And without any distraction, that joint now abducts. So I can push the calcaneus to the left, and I see the whole foot go outward to the right. And now I can twist him into adduction, and I see the front of the foot move medially. Okay? Pretty similar to the other foot in that direction, and pretty similar in this direction as well. So we've increased motion in that joint with a very, very simple maneuver. And let's have you walk down the hall and back. This is a wonderful foot model. We buy them from American Anatomical. I believe that's the only company that has a flexible foot. So they use elastic bungee cord in it. And so it allows all these motions throughout the foot instead of wire. And it's a high-grade model. And I think it's $125. I don't really recall. But I once owned a human foot, and I was able to block movement in the midfoot and see how the calcaneus and the talus moved. Then I could block the talus and then test how the calcaneus moved. Okay? And then I could block the calcaneus and then see how the talus could move in relationship to the calcaneus. Built a model for all these joints, blocking movement and then allowing movement of the cuboid and putting that all together. This was so very informative. This was so much better than looking at a wired model better than reading anatomy in a book, better than dissection, because you don't really get down to the joints. You don't clean out all the ligaments and such. So anyway, I also have a foot model with all the ligaments, which is very informative, and I like having both of those, but having a flexible foot is such a wonderful way to learn how all the joints interact with each other. So tell me, how do you feel walking? Are you aware of anything?
Yeah, it feels pretty good.
Come back and elaborate. So what's different?
I'm swinging my arm.
Did that restore arm swing?
Maybe a little bit.
Beautiful, because
Does that make sense?
we did note that you had limited right arm swing. And I am seeing arm swing now. So how very interesting. Improving movement in the right subtalar joint, increased right arm swing. And I couldn't find an explanation for the lack of arm swing.
Yeah.
I didn't find a tight AC joint, a tight rib in the upper body. I wasn't sure why you didn't arm swing. So now we know. Good, we learned something today. So how does the foot feel when you walk?
It feels good. It feels like it's moving.
Nice. So you can tell it has new motion.
Yeah.
Good. Do you know that that's going to be so easy to keep?
Is it?
I'll never have to treat that again.
Really?
You know why? Because every time you take a step now, that heel is going to move to its end range of pronation and then end range of supination, and it's just going to reinforce that movement. It's unlocked.
Nice.
Now, why that doesn't unlock automatically when you walk, we don't know. No one's done the research. We have limited knowledge about that joint.
Is it maybe the whole leg's moving differently?
Could be.
It's almost like a form of lumping. I don't know.
Before I stop filming, lay on the table, and I want to test your hip motion. Lie on your back. So we know that the body has a compensation. So if you lose motion in the subtalar joint, then the body will probably restrict motion somewhere else. And I don't really know where else it restricts it. But I know that you had very limited hip internal rotation on the right. So just relax. Let me do the work. And that's no different, so that doesn't explain it. Okay. Might be as high as your upper cervical, because the atlas, the first vertebrae in the neck, has a lot of rotation left and right. So maybe it freed up there. I don't know. But anyway, I thank you for letting me film this. And I love treating these joints. I just absolutely enjoy it, and especially enjoy treating the subtalar joint. So thanks again.
You're welcome.